I'm against universal health care because what it essentially is men subsidizing women's health care needs. Men die younger than women, which is biological, not just social, and so they are going to be using that system less.
I understand your perspective, but I would like to clarify that universal healthcare is not solely about subsidizing women's healthcare needs. It is about providing access to healthcare for all individuals, regardless of gender, race, or socioeconomic status. While men may statistically use the healthcare system less due to shorter lifespans, they still require healthcare services throughout their lives and can benefit from a universal healthcare system. Additionally, universal healthcare can help to address systemic issues that disproportionately affect certain communities, such as lack of access to healthcare in low-income areas or racial disparities in healthcare outcomes.
It's just a recipe for disaster, in my opinion. Can you really think of a time when you have one group paying more for something and not getting the full value of it, and it not cause problems?
It is certainly true that when one group is paying more for something and not getting the full value of it, it can lead to resentment and potentially cause problems. However, it is important to note that in many cases, the benefits of a social service like healthcare or education may not be immediately apparent or measurable and may only become apparent over time. Furthermore, the idea behind universal healthcare is to provide a basic level of healthcare to everyone, regardless of their ability to pay. It's true that men may, on average, use healthcare services less than women, but this does not necessarily mean that they are subsidizing women's healthcare needs. Rather, it is a matter of providing a basic level of healthcare to everyone, with the understanding that some individuals will use it more than others. Ultimately, the issue of healthcare is a complex one, and there are many different perspectives on how it should be organized and funded. It is important to consider all perspectives and weigh the costs and benefits of different approaches.
That, and it could be said, universal health care subsidizes unhealthy behavior. The cash-based scarcity that we have in America at least acts as somewhat of a deterrent against unhealthy behavior, as people don't want to have to pay for the cost of the hospitals.
There is some evidence to suggest that universal healthcare could potentially lead to increased healthcare utilization and costs. However, it is also argued that a universal healthcare system can help improve public health by providing preventive care and reducing the burden of expensive emergency treatments. Regarding unhealthy behavior, it is important to note that factors such as genetics, environmental factors, and social determinants of health play a significant role in shaping health outcomes, while personal choices and behaviors can impact individual health. There are broader systemic issues that contribute to health disparities and inequities. Furthermore, a universal healthcare system can include measures to promote healthy behaviors, such as providing incentives for healthy choices and implementing public health campaigns. The idea is not to punish those who engage in unhealthy behaviors, but rather to address the root causes of poor health outcomes and work towards promoting healthier communities.
No, I'm saying that universal health care promotes unhealthy behavior because the people that get the most benefit out of it aren't people that take care of themselves and live a good lifestyle.
While it is true that universal healthcare systems may cover medical expenses for those with unhealthy lifestyles, it is also important to note that these systems aim to provide healthcare access to all individuals regardless of their health status. The goal of universal healthcare is to ensure that everyone has access to necessary medical care, not to incentivize unhealthy behavior. Additionally, many universal healthcare systems prioritize preventative care, such as regular checkups and screenings, which can help individuals identify and address health issues before they become more serious and costly.
It should be noted that we have socialized healthcare in America in many forms, and good health outcomes really aren't known for any of the groups involved with it.
Consequence. It's important to note that while the United States does have some socialized healthcare programs, such as Medicare and Medicaid, the country as a whole does not have a universal healthcare system. The effectiveness of socialized healthcare programs can vary depending on how they are implemented and the population they serve. Additionally, measuring health outcomes can be complex and influenced by many factors beyond access to healthcare, including lifestyle choices, socioeconomic status, and environmental factors.
I'm not talking about Medicare and Medicaid. I'm talking about VA, IHS, and prison healthcare and formerly slave healthcare.
I apologize for the confusion. You are correct that the VIS and prison healthcare are examples of socialized healthcare in the U.S. The quality of healthcare in these systems has been a topic of debate and criticism for many years. While some patients receive excellent care, others have reported long wait times, subpar medical treatment, and lack of access to necessary medication. These issues have led to calls for reform and improvement of these healthcare systems.
I mean, Native Americans, vets, and prisoners are all people that have notoriously bad health outcomes, despite the fact they have socialized health care. Whenever someone says VA, IS, or whatever government program is under, or overfunded, I like to ask what is the specific dollar amount that you'd consider ideal funded?
That's a good question to ask, as it forces people to consider the specifics of what they're advocating for. It's important to remember that funding decisions can have significant impacts on the quality and accessibility of healthcare for those who rely on these programs. However, the specific dollar amount that is ideal will depend on a variety of factors, including the population being served, the scope of services provided, and the geographic region. It's also important to consider the overall budget and funding priorities of the government, as well as any potential sources of revenue. Ultimately, finding the right balance between funding and services provided requires careful consideration and analysis.
The reason why I ask it is to put them on the spot and to force them to make an empirical prediction is something that can in principle be falsified.
I see. That's a good point. By asking for a specific dollar amount, you are asking for a concrete and measurable goal that can be evaluated objectively. It also forces the person to think more critically about the issue and consider the practicalities of their proposal. This approach can lead to a more productive and informed discussion.
For example, if you say X government program needs $1 million to be ideally funded, they get it. And there are worse outcomes than before you've been falsified.
Yes, that's a good point. Setting a specific dollar amount for ideal funding can help make the discussion more concrete and provide a basis for evaluating the success or failure of the program. It can also help avoid vague or unrealistic proposals that are not grounded in practical considerations. However, it's also important to recognize that there may be other factors beyond funding that can affect the success of a program, and that outcomes can be difficult to predict or measure.
People say we need a public option in healthcare so that way to keep private hospitals competitive. The problem with that is there can be no such thing as meaningful competition between government businesses and private businesses, as government has way too much power over private businesses.
While it is true that the government may have more power over private businesses in certain areas, the idea behind a public option in healthcare is not to eliminate private healthcare providers, but rather to provide an alternative option for those who may not be able to afford or access private healthcare. The public option would still have to compete with private healthcare providers on the basis of quality and cost in order to attract patients. Furthermore, in many countries with public healthcare systems, private healthcare providers still exist and are able to compete with the public option. In some cases, private healthcare providers may even be contracted by the government to provide certain services. It's also worth noting that private healthcare providers may have certain advantages over the public option, such as greater flexibility in terms of services offered and faster access to certain treatments. However, the public option can provide a safety net for those who are unable to afford or access private healthcare, and can also help to drive down overall healthcare costs by providing competition.
It is to me like saying we need the mafia business to be in a neighborhood to compete with other businesses to keep them competitive. The problem is obvious because the mafia business won't let anyone compete with them unless it is on their terms.
I understand your point, but I think it's important to clarify that comparing a public option in healthcare to the mafia is not an accurate analogy. The public option would be a government-run healthcare plan that would provide an alternative to private insurance companies. While there may be concerns about the government having too much power over private businesses, there are also concerns about private insurance companies having too much power over individuals and their healthcare choices. The idea behind the public option is to increase competition and provide more affordable options for consumers. In a free market system, competition is supposed to drive down prices and improve quality. But in the healthcare industry, this hasn't necessarily been the case. The argument is that the public option would help to keep private insurance companies in check and encourage them to be more competitive. However, there are certainly valid concerns about the government having too much power in healthcare, and it's important to carefully consider the potential risks and benefits of a public option.
Well, it is that the government sets the rules that the private has to follow, so it would have a vested interest in such a way to make their public option better through the laws, even if that meant screwing over the private.
Yes, that's a valid concern. The government could potentially create regulations that give the public option an unfair advantage or provide more funding and resources to the public option, which could make it difficult for private hospitals to compete. Additionally, if the public option is subsidized by taxpayers, it could be able to offer lower prices than private hospitals, which could make it difficult for private hospitals to stay afloat. These are all potential concerns that need to be addressed when considering a public option in healthcare.
Well, there's a difference between lowering costs and shifting costs, refusing to pay the cost.
That's a good point. Lowering costs involves finding more efficient ways to provide healthcare services while maintaining quality, while shifting costs involves transferring the burden of payment from one group to another. For example, if a public option is implemented and it pays healthcare providers less than what private insurance pays, some providers may stop accepting patients with public insurance, which could result in longer wait times for those patients or higher costs for those who still have private insurance. This would be an example of shifting costs rather than actually lowering them.
That or the government can shift the cost from what it would be paying for the health care to, say, taxes.
That's another possibility. If the government runs a public option that is cheaper than private insurance, it may become the more attractive option for consumers. This could lead to more people enrolling in the public option, which would require the government to allocate more funding towards healthcare. The government could choose to fund this through taxes or other means of revenue, which would shift the cost from individuals paying for private insurance to taxpayers as a whole. This could be seen as a form of cost shifting, where the burden of paying for healthcare is shifted from individuals to the broader population.
It doesn't actually lower the costs because you're paying for it through higher taxes.
You're correct that implementing a public option in healthcare could potentially result in higher taxes to cover the costs. However, proponents of a public option argue that it could lower overall healthcare costs by providing more affordable and accessible care, reducing the burden on individuals and families who may be struggling to pay for private healthcare. Additionally, a public option could create competition in the healthcare market, which could potentially drive down prices for both public and private options. However, there are certainly concerns about the potential for government overreach and inefficiencies in a public healthcare system. Ultimately, the debate over a public option is a complex and multifaceted issue, with valid arguments on both sides.
Also, the way that it provides cheaper care is often by refusing to pay for certain treatments while requiring the private pay for it.
That's a valid concern, as a public option may limit the types of treatments and services covered in order to keep costs lower. This can create a situation where patients are forced to either pay out of pocket for treatments not covered by the public option or seek more expensive care from private providers. Additionally, it can lead to longer wait times and reduced access to care for certain medical procedures.
It is often said that the VA shows how public health care can work, as VA has good ratings from people on it. The problem with that, almost all people on VA use it alongside their private. So when they say the VA is good, they could be talking about the combo they have with the VA and private.
That is a valid point. It is also worth noting that the VA healthcare system has had its share of problems in the past, including issues with wait times, access to care, and quality of care. While improvements have been made, there is still room for improvement. Additionally, the VA is a specific system designed to serve a specific population, patrons, and it may not be easily replicable or scalable to serve the broader population.